Osteoporosis, if we're going to define the disease according to the National Osteoporosis Foundation, thank you very much for the reference. Osteoporosis is a metabolic disorder, a degenerative disease of the bone. The middle of the bone, the spongy bone, is now more porous. So osteoporous and an abnormal condition of this disease has to do with the aging process more often than not, but the metabolic process where now the bone loss is now outpacing bone regeneration. So bone loss is increased. So either the body is making not enough bone to keep up, or too much bone is being broken down too quickly, or both. What some of the risk factors, so what is the cause of this? Basically, it has to do with that metabolic disorder, the outpacing, the aging process, the degeneration of when patients get to around age 50 to 60, this is when those osteoclasts start outpacing the osteoblasts that build up. So we see osteoporosis starting to manifest. So as patients grow older, they become more and more prone to fracturing as their bones lose this. They become less and less solid in the middle and become more and more porous. What are some of the highest risks of this? Well, age, of course, right, as already been said. Being female, so postmenopausal female lose a lot of the estrogen they produce, which sends imbalance and causes calcium to be lost at a higher rate and leads to more porosity. The National Osteoporosis Foundation on their website states that as many as 1 in 2 women will end up breaking a bone due to osteoporosis, and as many as 1 in 5 men will as well. Other risk factors besides being female, smoking. So smoking does incredible vascular damage, and if vascularity is robbed from this bone will degenerate much faster. Alcohol, so chronic alcohol use, and that's if you're drinking a lot of alcoholic fluid. It sends imbalance and causes calcium to leave the bone, rushing into the bloodstream, and then as you urinate out the alcohol frequently due to the excessive fluid intake and the suppression of the antidiuretic hormone, you urinate out all your calcium before it has a chance to reabsorb, making it a high risk factor as well. Yeah. Rock on, my friends.